Hi everybody, it's Dr. Qazi. How are you doing? We're going to be talking a little bit about this case. This patient sent me a case actually just to talk a little bit about what kind of acne she has, what kind of scars she has. Every once in a while, people want to send something over to us. You could actually go to our website, drqazi.com, and we have a forum over there. And you actually could submit some photos, and we could take a look and see. I could give you kind of like a quick little overview. It's not exactly medical advice, but it is something that I could just be able to say, this is what I would suggest you should do, and potentially help you out. And, this particular patient is further outside of the country, unable to come all the way over here, and just wanted some advice on what to do for her skin. So I thought I'll help out as I'll wait for a few more people to show up, and we'll go through it actually. We'll go through just in general, what would I do with these particular scars, with this skin. This patient, she is, I think, ethnically from the subcontinent. And you can see, the scars that she has, a lot of them are tiny little rolling scars. She also has little ice pick scars. Hi, Martin, how's it going? And then she also has post-inflammatory erythema. So that's red spots. Those are little red spots. She doesn't actually have as much acne right now, but she does have these little red marks, the residue after acne. So sometimes actually that confuses people because number one, it could look like acne. Two, it could actually look as if it's sometimes the scars are a little bit deeper and worse than they actually are. So for that reason, really, it's actually pretty tough actually for a lot of patients because even if they cleared up their acne, they still have these little marks that are there, not just scars, but also these process of inflammation, post-inflammatory erythema. So we can see that really nicely for her over here. So if I were to treat this patient, I would want to treat, of course, her scars. I want to actually, though, before I do that, I want to control her oil production a little bit more. Since this is a woman, I would likely suggest something like spironolactone would be a good idea. But if we want something a little bit stronger, we could consider doing a low dose form of Accutane, or potentially even something like the Accure Laser. If she was nearby, I could say you could do the Accure Laser. That's an idea for you as well. But something should be done for her oil production. She does have some more oil production. She has a little bit of breakout. For us to maximize results, we really want to make sure that the oil is under control, acne is under control before we tackle these and do these procedures. And so that's one of the biggest things I would try to recommend there. What would you recommend for someone experiencing acne from Lexapro? You may actually want to do something like a topical antimicrobial, like dapsone, clindamycin. Those could be all ideas. Or you could actually end up doing something like the Accure Laser. Martin's asking, would Accure Laser help for that? Yes, we could use the Accure Laser. That can normalize acne as well, or normalize oil production. The challenge is that sometimes you do have some of the bacteria that's still on the surface of your skin, so you have to do some things like the antimicrobials help topically, but you may also want to do something like an oral antibiotic as well. So those are all options there if you have acne. Someone with, I don't know if you're male or female, but spironolactone actually could be a good option for you. If you're a woman, so that can be an option. You could also do topical Winlevi. That's another form of spironolactone that can help as well. Wait, the red spots don't fade over time. So a lot of times they do. You're right. A lot of times the red spots do fade, but sometimes they do get stuck. And even with some treatment, topical creams like azelaic acid, they still will linger there. And I see sometimes more commonly in certain ethnicities and other ethnicities where it could actually be prolonged redness. In those cases, a lot of times what we want to do is with a laser. Sometimes we use, after we do the scar treatment, what we would do is something like the V-beam or XLV. Personally, I have XLV. I don't have V-beam because V-beam I find could be a little bit more of a challenge in darker skin types, but XLV works very, very well. Cutera's XLV, so that's usually what I end up using. It's got it's got good contact cooling, so you could do it even in darker skin types. Let's see here, 5 versus 10% niacinamide. I'm thinking about getting 10, but need opinions. 10% is actually good. I wouldn't do much more than that, though. 10% is a good option there. Opinion on just dermabrasion. So for this, I wouldn't really do dermabrasion. This is something where I was actually going to get into the scar portion of things. But for these kind of, this is actually relatively superficial. So let's say she was in my practice. What I would do is I would do TCA Cross. I would change the concentration depending on the depth of the scars. So I'd go right in the center, right at the base of the scars, and actually help stimulate some collagen production right there. And then on top of it, I would do actually a low form of a fractionated erbium laser in her case. These scars are not too deep. I would say just a couple sessions of that is actually going to really help you out. And then later on in the future, we could do a little more TCA and now potentially something to give you a little bit of volume. I usually use Belafil over in this patient. She's from India. They don't have Belafil available, but you could try to do Sculptra. That could help as well. So you want to do something to give you a little bit of volume because whenever there's these indentations, a lot of times it's not just in the skin, but it's also a little bit of fat that's destroyed. So you have to do something for that. So that's what I would recommend there. I'm using a cleave and sometimes getting hyperpigmentation from acne. Thoughts? Well, you have to use a very strong sunblock because that could end up being a problem. It could be a big barrier. When you're doing any retinoid, that could be a problem. But if you're having it right now, you could try Eucerin's anti-pigment cream. That's a good option because it doesn't overly dry the skin. That could end up working really well. Would you be able to completely remove these scars? It's a good question. I think they're pretty superficial. I think that she could get a really beautiful result. Whether it be completely will be a good question. Bushra Aesthetics is saying, why not Radiesse? You could do Radiesse. I was actually talking to a patient today, though. The thing with Radiesse, though, is you got to make sure it's dilute. So really, you got to make sure it's a dilute form of Radiesse. And sometimes people don't necessarily use a dilute enough form of that. And not everyone's, comfortable doing it that way. This patient, she's in India. I'm not sure if she has access to somebody who could do it that way. Sculptra tends to be a lot of, something that's pretty common across the world. So that's particularly why. The thing with Radiesse is it doesn't give you as much volume as something like Sculptra would too, but it is very good for skin tightening, so it's really good for that. Let's see, Chino saying, hello, doctor, I'm getting V-beam laser while in Accutane tomorrow. Dermatologist recommended. Any tips? Well, I think that's going to be okay as long as, they're comfortable doing it. I want to make sure, though, just overall that you're using really proper sunblock and essentially making sure that when you're red, you're continuously reapplying the sunblock because anytime it's red, it could turn hyperpigmented. In this case, actually, for the last few days, I've been following up with all of our patients that we did last month, and nobody's had persistent hyperpigmentation even after 1 month. Amazing. Some redness, great. But people have been really, really good about sun exposure, really amazing, despite the fact that it was 109 degrees in a lot of places in California. Our area was 109 degrees, and people were still really good about that. So really, really appreciate that. Did all the follow-ups. Everyone was really good. How is La Roche-Posay moisturizer with niacinamide? That's a good option. I think it's a really good option for you. So you could consider that. Would this need subcision? I think it's a good question, actually. I was looking at this. Some of this, we need dynamic movement of the skin. I would probably want to just double check as I feel the skin, or look at the patient. She sent me static images in this case. And, I think that they're relatively superficial. You probably could get away without that. How much percentage could you improve the scarring? I don't know what percentages mean, honestly. I really don't. That's a good question. Hi is asking about the percentages. Anybody who does consultations with me knows I don't go into percentages because it's so subjective. I could show results all day long, and people will say, I don't know what that percentage is, and someone say this percentage, that percentage. So I don't know really, what the percentages mean. But I could say though that for her it'll be much less visible. It's not going to be a socially, something that's going to be concerning for her. So I think it's a great option though, because to do the scar treatments, because we could definitely get a really, really nice result in her case. Really superficial scars. Also appears to be a younger patient, so I think all those things are going to bode well for her with results. How long after controlling the active acne can we do scar treatments? Usually I want to make sure it's under control for about 3 months before doing the scar treatments. Can you talk more about risks and benefits of Accure Laser? So basically, it's really the same as Accutane. Really, it's working on the face, but without the other side effects on the rest of the body. At this point, treatment protocol, we really don't run into adverse events. At our practice, we do it on all skin types. If it's 1 through 6, very safely. Even on patients with melasma, we still don't run into problems. So I highly recommend it for patients who are concerned with any side effects of Accutane, want to avoid Accutane, we could definitely go ahead and try to do something like this, because we could really maximize your results when we do scar treatments ultimately. Because we want to calm down the oil production. We want to make sure that you have less active acne in the future. When we do these scar treatments, we really want to make sure that we don't run into new scars or prevent the collagen production. How much is the procedure? So most patients for our scar treatment spend about $5,000 to $7,000 on their scars. So hopefully that explains things for you. Actually, I'm going to show this result actually as well. So I'll show you this because it's a nice process over here. So this patient's not done clearly, but just I wanted to showcase this because it's in the middle of the treatment process here. And you can see when you look at this patient, you can see significant improvement. I'm going to just adjust the, let me see if I can figure something out here. Okay, so you can take a look and see for this patient, you can see the depth of his scars significantly improved. These are deep ice pick scars. He had significant, I wanted to show this to you because of look at how much volume loss occurred for him. Look at that volume loss, significant volume loss, significant volume destruction. And that's the thing that we're looking at. And so we solved all of these things. We did TCA, we did excisions for him. We did ablative CO2 laser, fractional CO2 laser. We also did sculpture for him. So someone is asking, is it $5,000 to $7,000 per session? So I don't do the same session over and over again. That's not the way I do things. I basically mix things up. I don't just do it the one thing over and over again. Just to give you an idea. Hi, Joey's little sister. Oh, awesome. You're Joey's little sister? It's awesome. Thanks for joining on. Let's see here. Could you use fat to fill in the scars? Well, this patient probably was a good candidate also for fat transfer, although he had no fat. Body fat was like almost zero in this case, really skinny guy. So that's why we didn't do fat transfer. But yes, if you do have some fat, we could do fat. Volume with fat works very, very well, especially if you use something like nano fat, could work very well for the stem cell purpose of it. Have you ever done V-beam on someone while on Accutane? Because I'm a little nervous. I haven't done V-beam. I use XLV. I think there's a better cooling with XLV, so that's why I end up using that one. Let's see here. I know I missed a bunch of questions here, so bear with me as a moment. I'm going to answer a bunch of these questions here. Hi from El Tipico saying he's from Tampa. Awesome. Love to have you on. But yeah, take a look at this. This is a really nice, realistic result. I feel like nobody shows you this process over here, and I love to just show that for people. It's job's not done, but look at it. It's really, really good. Job's not done. That's what Kobe said one time. He was, they were I think up 3 in the playoffs, and he's like, job's not done. Job's not done. I think we're hitting a home run right here. We're doing really good. But when patient has a little bit more funds, he's going to do some more treatments with TCA Cross, probably a little bit more sculpture as well. This area is in this part of the face with the scars. There's huge indentation right there with that. And what can end up happening is that if you overfill it, it could cause jowling. So you gotta be really careful as you do that. So you really want to make sure you don't cause it to be too heavy. Let's see here. I know if someone was asking some more questions, I want to see the thing. Do you like your job? Yeah, I love my job. My job is awesome. I love my job. Look at that. Look what I do. Honestly, anybody who talks to me knows I try to tell everybody who's wondering about what to do with their career. I tell people go into medicine. I think there's a lot of people. There's a lot of negativity with medicine. I think that there's a lot of great things you could do within medicine. You don't have to do this, but something. It's a lot of things are just it's really fun and really rewarding. I think separate the corporate side of things. Try to do things that are not necessarily within corporate form of medicine, but the actual treating patients and dealing with patients and working with patients and solving their problems. It's really great. And like I said, my connection's lagging. Sorry about that. I'll try to see later on. I'll try to boost this up a little bit faster. Sorry if it's lagging still. I tried to make it a little bit faster. It's in terms of my job and things like that. I think it's really fun, but I think people that are in the healthcare world can kind of attest that it really is, sometimes it's really tough, but it could be, it's ultimately really rewarding when you follow up with patients and you see that whole journey process. It's really, really nice. Typical is saying, I'm going to take that flight to California to put my face in your hands. Appreciate you, Typical. We'll see you soon when you come over here. How much is it typically for scars? Usually most patients spend about $5,000 to $7,000 for their treatment. And to be honest with you, everyone was asking about the future sessions. First of all, I do mostly a bigger combination session. And then let's say we need more TCA Cross, things like that. That's up to 55% off in the future. I'm the only place that's going to do that. Even more lasers are 55% off. Okay, so because I want to have this so that this is as affordable and as accessible as possible. I know that I'm going to hit it I'm going to make sure that I can get a slam dunk result under a single session. I'm really going to make sure that I can achieve that, but you are typically going to need other sessions. And so I know that, but I also wanted to make it super easy for people without like having you locked up with like some huge package of ridiculous stuff. I really do not believe in doing the same thing over and over and over again when it comes to scars. I think that we have to see how it is over time with your collagen response, and that varies depending on each individual patient, their ethnicity, if they had previous smoking history, sun exposure, all those things factor into it. So that's what I want to see actually. So I want to just see what happens with your skin. That's why I don't do this thing where I say, well, we have to do the same thing, 6 times, anything like that. I just don't do that. I don't believe that for scars, because I know that sometimes a lot of my patients, after 1 or 2 sessions of different things, they have amazing killer response. They have amazing, beautiful result. And that showcases to me that you didn't imagine. Now, if I tried to tell them that they needed, 3 or 6 sessions, and we already cleared it up after 1 or 2 sessions. And then it's also like, I don't want to hold myself back. I want to be able just to maximize results and just get really, really beautiful results for patients. So it's like I want to hit that out of the park every single time I do this. I don't want to have a thing where it's like, we look back and think that like, oh, there's a chance that we could just do this again, things like that. I want to just like get this so that this is beautiful, people. That's what I want to have this. I want this so that this is just a beautiful, beautiful result, and we don't have to worry about for patients. When they're flying in, probably 60% of our patients are out of state. A whole bunch more of our patients are actually from Northern California. So we have so many patients from out of states, and we want to make sure that we can maximize this under a single session for you as much as we can. Of course, I do say all the time for ice pick scars, you're going to need to do more TCA Cross. You're going to have to do more things. Of course, I get that. But I'm going to say I'm trying to get it so that I can maximize your results under a single session as much as I can for when you come all the way out here. It's really important. And honestly, that's what I do. And anybody knows it. I'll tell you something really, really, really clearly. Like, anybody knows this about me. Every one of my patients should always know this, that I really will make sure, and I'll tell you honestly, that we're at the same point that I want you to be at. 3 months out, 6 months out, I will tell you, sometimes it's not the case. I tell patients that. I do tell you. And if I feel like it's something that maybe it's like, for whatever reason, it's just like your collagen, you said you're doing everything right, everything's right, you're not smoking suddenly, you're stayed away from the sun, all that stuff, and your acne's under control. And it's like, we got to do something now to improve your skin. We got to make sure that we can maximize your results, and I'll take care of it. I will try to work on this for you. I will try to make sure that we can maximize the results for you. But we also have the scar warranty program. So that's just for like, we're on track. Everything's improving. Let's just continue to do that. And it's up to 55% off with a TCA laser. That way, I don't want it so that you stress about this that much. You just feel like, okay, you do it. You got the great results, but you want to get better and better results. We're going to work on it for you. We're going to help be there for you. Every step of this process, my team, I'll tell you honestly, everyone says, why don't I go to different places? Why don't I go to different states? The truth of the matter is that it's so hard to find people that could just understand this world, and anybody who's been to my office knows we don't have like this thing where we try to upsell. We don't do any of that kind of stuff. We just do exactly what's needed for the patient. That's it. I've told you guys before, I went through a process. When I had scars, I did Fractional lasers. I did microneedling. They sold me on a package of Fractional. They sold me on a package of microneedling. It did nothing for my skin. And then I ended up going to a big renowned plastic surgeon in Chicago. And this guy was upselling me stuff. He's telling me I need to do under eye filler. He's telling me I need to do Botox. He's telling me I was like 22 years old. And he's telling me to do all this stuff. And all I cared about, actually, I went to him to try to get Sculptra because even though I was just a young kid, I wanted to do something for collagen. I wanted some collagen product. I figured that's what I was reading about. That's what I was understanding was going to help me. So I went to him for Sculptra, and he didn't tell me he doesn't do Sculptra. Didn't tell me that he's not like an expert at Sculptra or anything like that. Instead, he just tried to upsell me stuff. And that's what I'm trying to avoid when I came into this thing. I was like, I was like, I'm going to do this so differently. I'm going to just nail this at such a different level and achieve this at such a different level. And then I saw everybody else was like, oh, what you need is your own skincare line. You need to do this, you need to do that. And, this whole thing, I was on the phone the other day and someone was talking to me about trying to get another skincare product line, all this stuff. It's like, I'm not interested in that at all. Like even a little bit. I'm not interested in carrying thousands of dollars and trying to push people on $1,000 of product. You know what I do for patients afterwards is people are on Vanity Cream, they're on CeraVe, they're on Cetaphil. We use our pigmentation cream, but beyond that, I keep it really simple and I don't try to have it so that people are spending $1,000. It's really offensive to me if you have to spend $1,000 on skincare because I could get you the results with laser. I don't need thousands of dollars worth of skincare with that. That's the truth. Luke is saying, I have super deep ice pick scars. What do I do? Sometimes you may have to excise those scars, literally physically take out the scar. Actually, I'll show you a patient that I did that on. And you can see he's a patient of African descent. And you can see just how deep his scars were and just how much improvement there is afterwards. So I'm going to show you that actually right now because you could see just with his skin. Look at this. This is a patient that I did excisions on, as well as TCA Cross, and we also did laser, but he's of African descent. Take a look and see that. And this is, a really, really nice, beautiful result over the course of, it says, 24 weeks. So significant improvement in just a few months. You can see, look at that. That's really, really nice. Of course, yes, there's more work to be done, all those things. But where we are right now from where he was, the amount of volume destruction there was, the depth of those scars, we improved that significantly. So we improved a lot. It took a long time. I'll tell you that right now. After his first month, he wasn't sure if he really saw too much. Then he started seeing a little bit softer. He saw some more. And then we came back. When he came in over here, I ended up doing some TCA Cross, a little bit more volume. Actually, his results are probably even better now. I haven't seen him in the last couple of years. But significant improvement, though, for his scars. Carlos is saying, if I want to get sculpture but don't want to do anything else, will it help? It's possible, Carlos. I got to take a look. I can't remember what your scars were. I remember you were going to come by at some point, and I will take a look at those. But it's possible if it's volume loss, it could help for that. But sometimes you have to actually break up the scar tissue. And if you don't break up the scar tissue, it actually ends up going into diffuse other areas. It goes into other areas for that. You really do need to do subcision. So someone is asking about subcision being invasive. There's no question. That's why I don't do it in every single patient. I had to do it on this patient. He's got very thick, deep scars. We had to do subcision for him, had to excise his scars. But I don't do excisions in every patient. I don't do subcision in every patient. I'll tell you that. I don't think it's ethical or appropriate to do in every patient. Sometimes there's patients where it's very mild scars. You don't have to do it that way. But when it's deep and tethered and stuck, honestly, just take a look and you could sell it yourself. Just look at yourself and see how your skin is folding around your scars. Just take a look and see. See if your skin is folding around the scars. Now just imagine that mechanical injury happening over and over and over every single day over the course of several years and decades. And just imagine what's going to happen to your skin laxity. So that is actually a bigger problem. That's actually going to cause you to age more prematurely because your scars are tethered down and pulled down, and your skin around the scars now is stretching. And you can't even smile fully. There's some patients who I talk to them and I'm looking at them and they're smiling and talking to me and they're really happy, but you'll see that there's a lot of asymmetry there, and it's more likely on the side of scarring. So the side that's scarred isn't smiling as fully. They don't have as full of that smile. So part of what I'm doing is bringing back people's smile. I'm trying to get their smile back, because otherwise you may not be able to achieve that really with any other treatment. You're talking about filler or things like that. A lot of times I see people say, oh, just do filler, just do that. Honestly, have you seen like filler 6 months out, a year out? Have you seen the result of that? Have you actually talked to anybody to see that result? I think it's worth talking to people. I dissolve so much filler. I dissolve so much hyaluronic acid filler. I just dissolved somebody today who had HA filler for her scars. I do it well, I wouldn't say every day, but probably 2 or 3 times a week. I dissolve that. So I dissolve in terms of acne scars. I mean, I dissolve filler every single day, but I dissolve when it comes to just for acne scars, probably 2 to 3 times every single week. And so I see the consequences of hyaluronic acid filler in scars, and it's almost never where it was placed. It's always shifts. It's like when the people have complications like this, it shifts and it makes their smile uneven, things like that, because now it drew in water, and it's just it did nothing for your collagen. So why not do things to stimulate collagen production? Whatever you decide to do something like that. So but do subcision if you have it. Just the problem is there's not many people do subcision though. Let's see. Next, Steph is saying, every time I get laser done, it leaves my rolling scar look worse. Why could that be? Actually, it's possible, although I wonder about it. It's possible it's taking away a certain layer of your skin, and then it's revealing a bit of the scar is a little bit deeper than after that. So it's possible. So sometimes it looks like the scar is thin on top, but then it's a little bit wider, a little bit deeper. Medina is saying, is radius or fat transfer better, and which is more expensive? Well, it depends on how deep your scars are. If your scars are very deep, then you potentially could just do fat transfer. That could be a great option, and ultimately could be a little bit less expensive than doing something like radius. Mel is saying, what do you do for keloid scars close to the ear, and do you offer payment options, care credit? We offer almost all care credit options. Alpheon, a lot of people choose Cherry right now. Cherry is just like, people really love Cherry. I'm hearing patients say that there as well. Coming on here, they say it as well. So a lot of people really love that. What is your favorite treatment plan for textured large pores on mature skin? So typically, a laser is going to be the best option, honestly. On matured skin, you really do want to use a laser. You could do an Erbium laser, CO2 laser. Those are all options there. Makeup by Leo saying, saving my money, see you. You have the best work from what I've seen. You're saving people's confidence. You will see me one day for my ice pick scars. Look forward to it, Makeup by Leo. Look forward to it. Really, really, hopefully I can help you out with that. Baby K saying, how much for the boxcar on face? Well, I don't do it just based on one boxcar price, but we'll have to take a look and see. I'm not sure what that would be. I can show you a boxcar result tomorrow, though. I'll show you a really cool one. I'm almost about done right now, but what's in the pigmentation cream is mostly kojic acid, licorice extract, a little bit of retinol as well. So that's about most of what it is. Hi, saying, do you patch test Beliful to see someone's skin reacts before doing it fully? We can if you request it, but mostly if you don't have a beef intolerance, also if you don't have a certain autoimmune conditions like sarcoidosis, scleroderma, you could do it. But yes, we could absolutely do it if you have any concerns or hesitancy. Fatima saying, I'm 24. Can I get TCA Cross? Yes, absolutely. We could do that. I do a lot of that. Does anyone know how much a treatment for ice pick acne scars costs? Just for ice pick, it could be $3,000 to $5,000, about that, depending on what's happening right over there. But most people, especially for more intense scars, could be about $5,000 to $7,000. How many treatments do you need for ice pick scar treatment? So ice pick scars, then each future session of TCA is usually about up to 55% off. So that means a TCA, if you did it initially in our combination session, then future sessions are up to 55% off. And our prices are on our website. It's pretty open about the prices. So go to our website. You can see how much I charge for everything. Really, like I said, patients will tell you that sometimes they'll even come on here and tell you that they only spend $5,000 to $7,000. That's about average for most patients. Let's see here. Jess is saying, Erbium ablative. Doc, let me know the difference for ice pick rolling scars. For ice pick, you don't necessarily use a laser for that purpose. You use it more for the rough edges right there. Future laser sessions are up to 55% off. That's correct. Yes. And most people take advantage of that. I'll tell you that. Sometimes people just do it just to get better and better skin. After they do my combination session, they just want to do that, and they get that. I'm like fine with that. I just want you to have great skin. And I'm like, sure, let's go. We know your skin now. We know how you react. You do your thing, and just making sure you're good with sun exposure. We'll get you really good skin, and ultimately just keep on working on it. It'll be really fun, right? It's really fun. All right, guys, thank you so much. I'm done for tonight. Really, really great having you on. Again, if you want, just submit your photos to us, and we'll be happy to help you out with that. and just answer more questions. What can you do for dark circle treatment? That's 3 different things. It's pigmentation, vascular, or it could also be due to volume loss. So I'll tell you really quickly. So if it's hyperpigmentation, you could use the Pico laser, works very well for that. If you have actually these vessels, then you could use something like a V-beam laser, or you could do PRP. Those are all good options. Or if it's volume loss, you may do some filler. Hopefully that helps you guys. Thank you so much. I'll see you again tomorrow, and you can submit your photo over on our forum actually.